So it's my honor now to introduce our keynote speaker, Los Angeles County Board of Supervisors Chair, Lindsey Horvath. Supervisor Lindsey Horvath was sworn into the LA County Board of Supervisors on December 5th, 2022. 1 year later, she became the youngest ever chair. She is the first millennial and currently the only renter to serve on the all-woman board, bringing a much-needed perspective to LA County leadership. Before being elected to the board, she was a city council member and the longest consecutively serving mayor for the city of West Hollywood. Upon taking office, Supervisor Horvath authored LA County's Homeless Emergency Declaration, bringing added urgency and transparency to the region's homeless response. Supervisor Horvath also appointed herself to the Los Angeles Homeless Service Authority Commission, where she now serves as chair, to focus accountability and transparency on the use of resources to address the emergency. A longtime advocate for women's and LGBTQ+ rights, Supervisor Horvath has made access to abortion and reproductive care a top priority, as well as standing with and for the LGBTQ+ community and other vulnerable groups. She is a voice for young people and is focused on bringing young and marginalized voices into the work of government. Supervisor Horvath's career has been defined by tackling the hardest problems, building diverse coalitions, and delivering results for her community. Her commitment to serving others was shaped by her family and faith, which instilled in her a strong work ethic and made her a tireless advocate in addressing the complex problems facing Angelenos. Supervisor Horvath has served on a number of regional boards. She received her BA from the University of Notre Dame and a certificate in nonprofit management and fundraising from UCLA Extension, which I did as well. And she resides in West Hollywood with her dog, Winston, whom you are likely to see out in the district. Please join me in welcoming Supervisor Horvath.
It sounds like Winston has a friend in the room. I'm so excited. I feel so at home. It's really great. Thank you, Trouty, for that wonderful introduction. It's always a little bit much to hear so much, but I'm incredibly grateful for the work that you do and for your leadership. I know your partnership has been tremendous for the county and for us in our office and for me personally, and I thank you very, very much. I'm really honored to be here with you today. I know that NAMI, Greater Los Angeles County, is the leading county-wide organization that promotes wellness, recovery, equality, and dignity for individuals and families affected by mental illness and the community at large. And I know that today I join you at a critical moment in the juncture of mental health in our communities. Finally, people are talking about what all too often was little discussed, and I'm grateful for greater interest in discussing and investing in mental health care, and I am hopeful that this change and openness is a credit to the vital advocacy you have been leading for decades. So thank you very much for the work that you all are doing. I want to start out by sharing a little bit about what LA County is focused on. All right, cheers over there. That's good. As you know, Los Angeles County provides essential social safety net and specialty mental health services that our community members rely on. The Los Angeles County Department of Mental Health is the managed care plan for specialty mental health services, and these include the highest mental health acuity needs. And this is a responsibility that I personally do not take lightly. I want you to know that I will continue to champion and support initiatives and policies that will more holistically integrate all levels of care and services, including mental health, to be more comprehensive, equitable, and accessible. And when I became chair of the board last December, I spoke about the crisis of despair, especially for our young people and older adults who are living in isolation and loneliness. We know that these are crises of our moment and our time. Anxiety, depression, and substance use are pervasive. These issues, when overlapped with systemic evils of war, violence, and enslavement dangerously compound. And this is why greater attention is on our Department of Mental Health and the county as a whole. Our communities, our cities, all of you are looking to us to get it right. And like all things, we will if we do it together. So let's be frank. There is a lot to do. The state and the county are at a pivotal moment of transformation in behavioral health. So to name just a few things, first, Prop 1. With the passage of Prop 1, there will be a monumental $6.38 billion bond package to build new behavioral health housing and treatment beds throughout the state. Though I will note, there will be growing need for funding services to match that housing, and so we must continue to invest in the services while we also build the housing supports. The Round 1 application is currently underway, and the county will be applying for a couple of projects in this round already. In my district, we're applying to fund a 48-bed facility at Olive View Hospital in the Northeast San Fernando Valley for individuals struggling with acute and subacute mental health needs. My colleagues are also citing projects in their districts, and just last week, the board approved reallocating ARPA funds for a 200-bed project in the 4th district. We need to build a full spectrum of treatment beds throughout the county. Every community is in need of this support. We know this, and we have to act that way throughout the county. We need these beds in every community and every district throughout the county. Just like we need, oh, you can clap for that. Just like we need the full complementing of housing options to address our homelessness crisis, the same can be said for our mental health system. And the only way the county can provide these much needed services that everyone looks to us for is if our local government partners help us site these beds. We cannot do it alone. It is no surprise to all of you that we have bottlenecks in our system of care, and that we must continue to increase our bed capacity to ensure we're meeting the mental health needs of our communities. So thank you for being part of the ongoing conversations at the board and in our community about how to get this right and helping to lead us in the right direction. Another aspect of what's going on at the state is Care Court, which launched in LA County on December 1st, 2023, almost a year ago. The care process, as we know, is a voluntary civil court proceeding, which is intended to be collaborative and supportive in its approach for qualifying individuals diagnosed with a disorder within the schizophrenia and other psychotic disorders class who are currently experiencing symptoms. And thanks to NAMI GLAC's partnership with our county departments, and thanks to many of you personally in this room today, education and access to Care Court has been made available to many in our communities. As of October 2nd, 272 petitions have been filed, out of which 70 were dismissed for various reasons, including because the client is already in stable treatment. 21 care agreements and 4 care plans have been executed. Admittedly, this is not where people had hoped the program would take us at this moment in time. That said, the county is working to improve what we can on our side to make sure that we are fully utilizing this tool to the best of our ability. And there still is more education and engagement to be done to ensure that individuals who do qualify can get help and support that Care Court provides. But this should be taken as a warning that no one tool is going to solve the crisis we face by itself. This is an important tool in a toolkit that we need to continue growing to meet each and every need that we see in our communities. Another tool that the state has provided us recently is Senate Bill 43, which was signed by Governor Newsom last year as well. And among other changes it makes to the Lanterman-Petra short conservatorship law, SB 43 updates the definition of grave disability to include those who have a severe substance use order, those who are unable to provide for their personal safety, and those who are unable to provide for their necessary medical care. Properly preparing to implement SB 43 is essential and complex. Among other things, it will require the development of new criteria for involuntary treatment. the training and recertification of thousands of local providers and law enforcement agents on those new criteria, working with our managed care plans to ensure that our bifurcated Medi-Cal systems are operating harmoniously, and creating sufficient capacity in our already overstressed and under-resourced treatment facilities for involuntary treatment. We have to get this right, especially considering that our community members' individual rights are on the line. And given the immense amount of work that the county is facing to prepare for implementation of SB 43 and to ensure that we're ready to provide care for expanded populations, my colleagues on the board and I approved implementation on January 1st, 2026. Some of the unintended consequences from the bill, such as there being no state code on locked substance use facilities, need to be addressed to not only avoid liability concerns, but to make sure that we fulfill our obligation to truly meet people where they are and provide services that are truly supportive and helpful, not harmful. And so, yeah, all right, there's agreement in the room on that. And so, again, to me, it is important that implementation is done correctly, that we get this right, and we take it seriously. This is a tool that I am interested in seeing how the county is able to use it, but we have to be thoughtful in how we implement it. And 14 months may seem a long time away, but I promise it will come quickly, and there is no time to waste. And I have learned in county time that's basically a blink of an eye. Our county departments have been hard at work engaging key stakeholders and partners at all levels to ensure equitable continuity of care. We cannot get this wrong. These are our friends and our family members who may be impacted by the new policy, and we need to ensure that everything starts with care first. In terms of behavioral health, our current systems and funding streams place people in boxes that meet certain criteria for certain services. But in this work, we can never lose sight of the fact that people are people and our unique traits do not fit in a box. It's our responsibility as policymakers to meet people where they are and not the other way around. And we know we can't ask people to seek out these services on their own. The system works best when we come to you and connect with you in a space that is comfortable, supportive, and really delivers that care that the county is committed to providing. There have been many considerable efforts to moving in that direction, but we still have a long way to go. And we have to continue to push forward. So let's start by rethinking the intersection between mental health, addiction, and treatment. We need to create a holistic health system that provides adequate care in the midst of a substance use and mental health crisis, focusing on prevention and leading with care. The Department of Mental Health and Department of Public Health, Substance Use Prevention and Control, are more closely collaborating on policy and service implementation. But it is my expectation that the collaboration will be truly reflected on the ground where people are accessing these services. And I can't emphasize enough, the holistic care is the only way forward. We know that co-occurring diagnoses are common and often more challenging to treat. When we put people first and coordinate their care, outcomes will be better. People's lives will be changed, and that's what matters most. I also want to make mention of our young people. Our young people are facing mental health challenges unlike previous generations. I call them the most disconnected of connected generations. All of this technology is supposed to bring us together, and I think in many ways has divided us and especially impacted our young people. And they're experiencing severe mental health consequences, and we've seen study after study reflect this, especially our young girls. And the long-term consequences are serious. And so programs like the Boys and Girls Club in Malibu provide the kind of supportive care for our young people that we want to see expanded throughout the region. And I want to make sure that we are continuing to invest in the care of our young people, because if we're not starting at these very early stages, that leads to even worse outcomes. I also want to address the issue of homelessness. Nowhere is co-occurring diagnoses more true or more visible than our homelessness crisis on our streets in Los Angeles County. This is why I authored our motion to declare an emergency on homelessness in Los Angeles County nearly 2 years ago. And one of the pillars guiding our response is providing mental health and substance use services. Estimates range from 30 to 60% of people experiencing homelessness are also suffering from a mental health diagnosis, whether that's something that triggered after they became unhoused, or it's something that caused their being unhoused. If we're ever going to significantly tackle homelessness, we must continue to break down barriers between the homelessness response and mental health care systems. The status quo has got to go. Siloed efforts funded and deployed by different jurisdictions across the county do not benefit from the power and impact of a strategic, thoughtful regional response. Emergencies require new solutions. And that's why I introduced a motion that the board approved to establish a regional emergency centralized response center. You can think of this as like a public safety dispatch, but for homelessness services. The command center will centralize decision makers from county departments, from our cities, and from other governmental partners to coordinate a unified regional response to homelessness, building on the foundational best practices of collaboration and information sharing. By centralizing resources and information at the command center, will require embedded staff and committed participation from local jurisdictions to enhance service delivery, support shared goals, leverage regional resources, and improve outcomes for people experiencing homelessness. Now, I admit this doesn't sound like rocket science, and it shouldn't be, but coordination is sorely lacking, and that's why this center will make a big difference. Since I was elected to the board and appointed myself to the Los Angeles Homeless Services Authority, I don't serve as chair anymore. We changed in August, so Wendy Gruhl is now the chair of LAHSA. Collaboration and communication are the keys to building effective systems of care. We also have other bodies like La Casa, which focuses on housing itself and how we preserve affordable housing and create more of it. And the executive committee, in partnership with the leadership table, which were recently created, are even more places for engagement where we need to deliver more outcomes for all the work that is happening. The bureaucracy isn't good enough. We can't keep creating committees if we're not creating different outcomes. We must also continue to expand on a care-first approach that partners with individuals struggling with mental health, providing them with services they need in the places they feel most comfortable accessing them. And this will require eliminating red tape that stands in the way of better serving our most vulnerable residents. Now, I want to thank NAMI for all the work that you do, every single person here today, for being a constant voice for the vulnerable. You are among the largest NAMI chapters nationwide. Last year alone, you served approximately 40,000 individuals and families affected by mental illness. 40,000 lives changed because of you. This is real impact. You are a driving force for key mental health issues in LA County and a key resource for individuals and families affected by mental illness. And what is particularly notable is that about NAMI GLAC is how community-led you are. You serve an incredibly diverse population with grassroots chapters led by people and families with lived experience. Your membership, those who are part of NAMI, reflect the diversity of Los Angeles County, the diversity of need, the diversity of identity, the rich diversity of Los Angeles County. And your work matters. And I want to note the impactful programs you're leading. Evidence-based programs like Family to Family and Peer to Peer empower families and individuals with knowledge about mental health conditions. Facilitation of peer-led support groups for individuals living with mental illness and their families, foster connection and understanding, and collaboration with law enforcement and mental health agencies improve responses to mental health crises. So we are treating them as health crises and not as crime. Additionally, NAMI endeavors to advocate for policies that prioritize care and put people first. These policies include ensuring that individuals always receive appropriate levels of mental health treatment, regardless of setting, establishing alternative crisis responses to people in crises in the community without the utilization of law enforcement whenever possible, while ensuring that any interaction preserves their health, well-being, safety, and dignity. Enacting policies that divert people living with a mental illness from the criminal justice system to the healthcare system to advance their recovery. Advocating for a strong mental health workforce capable of meeting the community's needs for improved availability, accessibility, quality, safety, and most importantly, dignity and mental health treatment and the other mental health support services that people seek. And I just want to thank you for the ways that you're also inspiring people to come into this field. I was sharing outside that even if our Department of Mental Health had no vacancies, every position were filled, there would still be more work to do. And we would never be able to do the work that we're doing in Los Angeles County without you. And your leadership and advocacy help uplift that. So people know that this is a workforce that we are developing, that this is a field we want to welcome more people into, and it's a workforce worth coming into. The experience is truly rewarding, and the stories that you tell and the way that you uplift them inspire people each and every day. I also want to acknowledge that prior to my service on the Board of Supervisors, I appreciated the tremendous partnership that NAMI offered specifically in the city of West Hollywood. And it taught me how collaborative, creative, and committed you are to change making in our systems and for our people. Thank you. As a supervisor, I am proud to partner with you on these important policy efforts and so much more. The purpose of today's conference is to connect with individuals and families of diverse communities and shared experiences of mental health struggles, to address the challenges and progress related to mental health, and to take with you a renewed sense of hope and empowerment. I encourage all of our conference attendees to continue engagement with the policymaking process by making your voices heard and advocating for the mental health community. And I've appreciated the meetings I've personally had in my office. Thank you for coming. Please continue to come visit us and also to work with my staff. Our entire team is incredibly grateful for the ways that you show up and work with us. I encourage all conference attendees to continue engagement with the policymaking process. Now more than ever, we need you. We need your ideas, your experiences, and your grit, because I know that this is not new for you and you continue showing up, even when you see the failures of the system, even when you see where the county falls short. You don't give up on us. You challenge us to be better and do better. And I thank you for that. I thank you for that part of our partnership, because accountability is key. If we aren't accountable to one another, we're not going to make this better. So I thank you for that work. Everyone's voice and experience matters. The change we all seek will only happen with continued conversation and action around mental health in our communities. I thank you so much for inviting me here today. And on behalf of Los Angeles County, I want to present this scroll designed by the wonderful artists of LA County to NAMI, recognizing this wonderful occasion and in celebration and recognition of your tremendous work. Thank you very, very much.